As Dr. Tanjasiri just said, our you should be getting a pop-up notifying you of this recording. I am so glad to be welcoming you all to our info session on our newest PhD program in Health Society and Behavior. My name is Sean Arayasirikul. I use they them pronouns. I'm an associate professor at UCI in the Department of Health Society and Behavior, and my work is focused on um, the impacts of discrimination and various types of oppression on sexual and gender minoritized community health. I'm going to turn it over to Dr. Tanjasiri for a brief introduction, and then Dr. Tanjasiri will work us through about half of the slides, pass the baton back to me for the second half. We hope that during this information session, we're able to kind of go over the nuts and bolts of applying of the program, applying the application process, and then have ample time for folks to have ask questions and really get into some of that knowledge sharing at the end of our short presentation today. Dr. Tanjasiri?
Great, thank you. So welcome everyone. Can everyone hear me? Okay, yes. My name is Sora Tanjasiri. I'm a professor also in the Department of Health, Society, and Behavior. My work focuses on cancer health disparities, broadly defined, but also specifically in the areas of cancer prevention, early detection. And I primarily work with ethnic racial populations. I too am very excited about our new PhD program. We are just wanting to be able to share all the information with you so that you can make the most informed decisions for yourselves and also know how the kinds of things that we'll be looking for and if and when you get into the program, what you might be able to expect. So moving forward, our agenda is pretty straightforward. We'll do a brief overview of the program, and then I'm going to be turning it over to talk a little bit more about the nuts and bolts around applications, admissions, funding, and other opportunities. And then we hope to have time at the end to entertain questions and answers. I do also, again, want to note, we are recording this informational session and we will be posting it on our website. You can see here, it's the general public health website on PhD programs and degrees. So if you want to refer back to it and or share it with anyone else you think would be interested, we encourage them. Okay, so just a little bit of an overview of what the program is designed to do and why we feel it provides a really nice opportunity that is different from the other available PhD programs in our school. So in a nutshell, this program is, again, a doctorate, a PhD program, and it's designed for students who really are interested in understanding the complex interplay between social, structural, behavioral influences on health and health inequities. The curriculum is really designed to be able to help you, to expose you to kind of foundational tools in each of these areas and being able to apply them to critically analyze health-focused inequities, and also evaluating the potential of different interventions, and including community interventions and policy interventions aimed at addressing these inequities. A key component, I think, that you will find that is standard in, I think, most PhD programs and the way that we're organized as well, is that there is a combination of core and elective coursework. We do have an ongoing seminar series that will be required for our students when we get this one off the ground. And then, of course, sort of the usual combination of work experience, research experience, et cetera, that we will go over in a bit around funding opportunities. And then, of course, the dissertation proposal and defense. We will say that we entertain both the traditional dissertation proposal and or what some people kind of fondly think about it as a kind of a 3-article option to the dissertation. Probably don't need to be too worried about that now, but we do embrace, either model. Enrollment is designed to be full-time. And time to degree really actually depends on what you come into the program with. For example, if you have a master's in public health already, we anticipate that it would take you about 4 years to complete the PhD. If you don't have MPH, we anticipate it could take up to 5 years. And again, these are rules of thumb. No one's going to be pushing you out if you don't meet 4 years, for example, with the MPH. But this is what you might be able to expect in sort of a general rule of thumb. We, of course, introduced our own expertise, but I think one of the wonderful opportunities about joining this and pursuing this PhD degree is the ability and opportunity to work with all 19 of our faculty members in some way, shape, or form, taking coursework, core classes, elective classes, seeking research. You do not need to do research with only your, let's say, primary mentor or advisor or dissertation committee members. This is the whole reason you would be doing PhD, is to be able to pursue potentially multiple interests that you have. And so, of course, we have a very shortened list of the areas of expertise and encourage you to seek more information from the Josie Wen School of Population and Public Health website that will list all of these faculty under the PhD program specifically. And you can do a deeper dive into the kinds of nuances that each of us focus on. One of the things that we think you might be interested in, because we certainly are getting a lot of questions around this, is, well, what does advising look like? And we want to just start by saying you do not need to have identified an advisor or a likely advisor to apply to our program. In fact, we think that the multi-level nature of our PhD will attract people who have varied interests. So please know that during the process of application, you would be matched initially to potentially an advisor or a few advisors that we think can get you off the ground in terms of setting you up for success in our program. You do not need to pre-identify an advisor in order to apply. However, so you don't need to have confirmed that someone says, yes, I'm taking a student. In fact, all of our faculty have said they are interested in advising students. And it would be by the nature of your essays that we are able to determine who you are interested in, if you want to name them, and by describing your research interests. That will be our cue to be able to make some initial steps in terms of making that match. We also believe that advising will evolve as your interests also grow, deepen, or broaden. And so advising can also be an ongoing process of getting faculty expertise at the time that you need it, and for the decisions and opportunities that you're pursuing. And lastly, we are still developing this. We don't want to say that we've finalized all of this, but we really envision that this will be a team-based model, so that you won't have the traditional models are you have one advisor, you're assigned to the advisor, and then that's the person who guides you for the rest of your doctoral journey. We recognize that that is really not in reality how it often happens. And so again, the idea is that you might have more than one advisor, and there could be some flexibility as your interests evolve and hone in on your dissertation. Okay, so bottom line, do not feel compelled to reach out to specific faculty members and secure their interest in you before you apply to us. Okay. And with that, I'll turn back to Dr. Arayasirikul to talk about the application process.
Thank you. So is it possible that I share my screen so that I can advance the slides? I would really hate, awesome, thank you. I really hate for someone else to do that.
Sure.
Thank you. So you should see that. Let me just go into, okay, sorry. Do you see the screen okay? Awesome. I wanted to pick up on that last bit that Dr. Chandraseri just mentioned, which is you don't have to um, go into a conversation with a potential faculty member with the outcome that they need to sponsor you or that they've agreed to take you on. That is for other programs, maybe a particular requirement. For our program, it's not. However, we do encourage you to reach out to faculty. We want you to reach out to faculty and have conversations if that is something, if you are at that point and you feel inspired to. We don't want to put up a blockade for that kind of communication, but we don't want you to have on your shoulders the weight of having to have someone say, yes, I'll take you on as a student. That is not a requirement for our program. So in terms of the applications, there are minimum requirements. You must have a grade point average of at least a B or a 3.0. We expect that all applicants will have have completed their bachelor's degree from an institution prior to enrollment. We would like to see in your application conveying strong verbal and quantitative skills. Of course, this can be seen and reflected in your essay components, also in your transcripts, in marks that you've received for particular courses, and also reflected in the letter of recommendations that may also accompany your application. So wanted to put that out there, especially since we do not require the GRE. We are still looking for strong verbal and quantitative skills. And there you go. The GR is not required. And specifically for international students, one of our requirements are related to English proficiency. I believe that in the application process, you will be linking your scores, either TOEFL or IELTS. And as per the university, there are minimum scores of an 80 on TOEFL and 7 on IELTS with regards to demonstrating your English proficiency. You may have this particular requirement waived if you have earned an undergraduate or master's degree from an institution in which English was the sole language, according to the World Higher Education Database. You can also seek out more information here at this link specifically for international students around this particular requirement. Applications are due December 1st. This is I think, a widely adopted deadline for schools of public health. Our program application requires an application that is submitted through the SOFIS site. SOFIS is the kind of coordinated application platform for all schools of public health, and we require that SOFIS application to be completed first, and then we have a follow-up application, which I'll go into in a bit. Completing the SOFIS application, you can create an account and log on, and related to submitting that application, there is an application fee for $150 for the first program. And how SOFIS is designed is that you can easily complete one application and select multiple programs to apply for, and there's an additional cost for additional programs. There is a fee assistance program. However, you must seek that out by contacting SOFIS for a fee waiver. You can go ahead and there is a tab on their main page that you can find more information about how to go about that. The second, after you've submitted your SOFIS application, you will find that in the SOFIS application, we allude to understanding that the applicants must submit a graduate application for UCI specifically, for the graduate division at UCI. And so here is the link for that particular second part of the application that has a separate application fee. And if you would like to seek out a fee waiver, there's information there on that website to reach out to the appropriate points of contact for to request that fee waiver. And so we can't stress enough that in order to successfully apply to our program, there are two applications you must submit, the SOFIS application and the UCI graduate application. Moving on to key components of your application. There are a set of essays that you will be asked to produce and to enter. These essays should include your research interests. We would like for you to talk about not just yourself, but also in particular, what are the sets of interests that you've already cultivated, and how do those interests map onto or resonate with the program and the program's areas of focus or foci? We would encourage you to have alignment with one or more program faculty. Again, prior contact or confirmation that a faculty member is taking on students is not required prior to the application phase. But we really would like to see, again, here making the connections between your research interests, how those interests map onto the program and the specific areas of focus in our program, and then also the work of faculty associated with the program itself. As far as admissions, this is our approximate timeline. It's very rough. There are some hard deadlines, as I mentioned. The applications are due December 1st. We will continue to review applications in December. We hope to have interviews scheduled the beginning of January after the holiday, and then conduct the selection committee will convene, make recommendations to the UCI graduate division in February, and then offers will be sent by a graduate division to candidates in late February through March. So again, very rough timeline. And we'll talk a little bit about funding opportunities, and hopefully, if folks have questions about this, we can get into that in the question and answer session. With regards to funding, we support all students that are accepted. We support students with funding that includes coverage of tuition and fees and health insurance for the 4 or 5 years that you are completing our program in. You will also receive an offer for subsidized on-campus housing. And this funding will be in the form of a teaching assistant or a graduate student researcher and or fellowship opportunity. How I break this down is that full funding may still be quite limited, but it will cover costs for tuition and fees and health insurance. And in exchange requirement, we require that students serve as a teaching assistant or a graduate student researcher. Financial support technically is contingent on satisfactory academic progress and remaining in good standing. So doing well in your coursework. Also, we require that students are enrolled full-time as a graduate student, and that for us is 12 units. We also require that students comply with all policies as defined in the UCI graduate policies and procedures in order to be funded during your education. So there's other funding opportunities. I think that as much as as much as we're able to support your base funding here to attend UC Irvine as a graduate student, um, students often also seek out other funding opportunities such as scholarships. Here are some scholarships that we have connected students to at public health. We also have university fellowships, which we take nominations annually once students are already admitted. Some fellowships are at the admissions stage, so there's a mix there. But the fellowships that you will find here on this link are mostly fellowships that are made once after students are admitted. And then there's other resources for here on this link for other forms of employment on campus and off campus in order to supplement costs of living and other costs of attending. Again, we will cover fees and tuition and health insurance, and you will also make a stipend related to your work as a teaching assistant and or graduate student researcher that is hourly. And note, if you are offered assistance such as loans through the Office of Financial Aid and Scholarships, this may cause other needs-based funding to be adjusted downward and accommodate limits placed on the total amount of support that you can receive from the university. And these are all questions that you can work with once admitted students receive their letters that they can inquire with our graduate program, our doctoral program director, I'm sorry, graduate program a staff person to ask any other questions about financial aid and scholarships and need-based funding. So we will get into questions and answers. I will stop sharing. Oops, I will stop sharing and then open up the floor for questions. I'm going to check oops, I'm
We
going
have
to,
one, the first is a very long question regarding funding, so I've been trying to chip away at it. This is from EK. I think I've answered the first two questions. Fellowships. Fellowships. Uh, uh, so in general, we have a lot of international students, and so if fellowships, when in general fellowships are available to all students, and you can actually go to our public health website and look at the list of scholarships and fellowships, and you will see that there's no, it doesn't specify, for example, domestic. Now, we can't control the other ones that are available if you want to go to something that has been funded by, X, Y, and Z. So teaching assistant and research assistant, or what we call graduate student researcher, are available as well to international students as they are to domestic students. Are there extra requirements? Yes, you have to show English proficiency to be eligible for those for a TA's teaching assistant positions. Housing and support. So every accepted student gets an offer letter, as already been reviewed, and in that offer letter, you are offered the opportunity to have on-campus housing. The cost is not covered, but you are automatically offered to be able to get access to that housing. How does subsidized family housing for international students and what childcare dependent health insurance support? Oh, that gets very specific. I unfortunately don't know the answer to that. Dr. Arayasirikul, do you?
either. I know that there is on-campus housing for families. In relationship to how housing is assigned to students. It is all a lottery system, unfortunately. And so at the beginning of the year, leading up to orientation, you would identify your preferences for housing, and then in the weeks that follow, they will assign assignments for housing. But there is graduate family housing on campus. And I don't actually see that question on my chat, so I may be missing
Ah.
some details about that. I'm sorry.
The last part of this question is, what support does the program provide with visas and health cover? Um, and I think application fee waivers. So I think we talked about application fee waivers already. You can go to each of the sites to look at the specifics. If you're an international student, unfortunately, UCI does not do a fee waiver for you. The SOFIS, you can get access if you meet the SOFIS requirements, but UCI does not. That applies to just international students. Provide support with visas and health, what I think is health coverage.
Yeah,
Um,
I think that so the International Student Center works with all of our students to get visas. Once you have an offer letter and have indicated that you would be accepting our offer. So that is part of the process. We've supported many international students, help to successfully get their visas and acquire all the documents necessary to move and set up and successfully be prepared for the start of the academic year here. I believe this particular cohort, there are at least half our international students in our last cohort.
Thank you. The next question is, I think I didn't answer the one question about transcripts. So if you're currently in the process of completing a degree, obviously we'd only get a transcript up through the coursework that you've completed. As long as you're set to graduate right before you enroll in our program, it does make you eligible to apply. Let's see, unofficial transcripts must be uploaded to the application, and official transcripts from your degree granting institution will be required if you're admitted and decide to enroll. Thank you, Claire, for that clarification. Let's see, a question, I believe the next question is, how do students typically pay for housing? So I think we've already gone over the funding opportunities. So you do get access to being a TA or GA, or what we call GSR, on campus for all 5 years. I do not know the pay scale, but it is nice. No one's going to get rich, but it is nice. But the only thing to consider is that you're only allowed to work 50% if you have an on-campus job. Now, this doesn't preclude you from working off campus for any position that you would like, and that is actually not uncommon for our students to do. I'm not sure how, so typically pay, I don't know, but I assume from a combination of TA, GSR, fellowships, scholarships, etc. Let's see, I think I already answered the question about if you have an undergraduate GPA versus a master's GPA that is above or below, and yes, you're eligible if your master's GPA is over 3.0. Okay, so the next question is, how open is the program to students bringing in bridge, in quotes, research questions, for example, linking transportation, urban design, and public health? What opportunities exist for interdisciplinary collaboration, say with departments like urban planning, design, departments, transportation, or environmental science? Would you like to take a stab at that? I'm not.
Yeah, I think that I think we're very open to ideas that stem across various sectors. Our program is really focused on how structural determinants come together in order to produce health, and by virtue of the work that we do, also produce illness. And so I think that we would be very open to some of those what might be multi-sectoral research questions. Again, I think that with all, just in terms of good advice for writing strong graduate or doctoral applications, your experiences shape your interests form your research questions, your research questions and interests should be strongly supported by the program that you are applying to in the materials that you have available to you, as well as also the faculty that represent that particular program and that institution, so on and so forth. So there should be a good fit between the kinds of questions that you are asking. And I think that it would be my question to you in as you think about your interests is actually what is the public health piece to those that mix of interests? How does it speak to our particular PhD program and our focus on these multi-level structural factors? And if you're able to kind of work through and see and have clarity around what you'd like to do, I think that that is a good fit, and we would be very open to those topics.
Thank you for that. There is another question about letters of recommendation. So should letters be submitted through SOFIS? Are they also required to be submitted through the grad app portal too? And I believe SOFIS takes care of
Yep.
that. So just upload it through SOFIS. How many
And
letters of recommendation are preferred? I believe the number is 3.
and a max of 5.
Yeah, thank you. So 3, minimum of 3, maximum of 5. This is an interesting question. How many students are typical in each incoming cohort? Since this is a new PhD, we don't have a typical number, and the numbers are set by the university based off of funding available. So we won't know for sure until the time when we're reviewing applications and so we usually develop a list, right? And then when we know the number that we can accept, we will then go through the list to start making the offers. Unfortunately, I'm not sure I can be any more specific than that at this stage. Everything else would just be conjecture.
Yeah, I think that outside of conjecture, I think it's probably safe to say too that everyone is well aware that public health funding is quite contested in this moment in time. And so we anticipate that we won't be able to support as many students as we have in the past. And so we expect that this current cycle will be quite competitive and smaller than cohorts in the past.
Yeah, and I think that gets at the question about how many applications do you receive and what's the acceptance rate. Unfortunately, we don't have any historical data to be able to share with you. But I think the rule of thumb is it's going to be a tighter year just because of what we suspect
Yeah.
to be some of the additional constraints that we don't usually see. Is the program classified as STEM program where international students would have the opportunity to opt in, right? That's right. So my understanding, oh, go ahead.
I believe it is, yes. The PhD program is STEM designated. I believe that there are some MPH, some master's level programs that are not, but I believe that our PhD is STEM focused.
Great, thank you. There's another question that says they've been working at UCI and was able to do an MPP program while still working on campus. How feasible do you think it would be to enroll in this program if accepted while still keeping the position? And I think it's a full-time position as a staff member. Well, so the issue is that you are not able to work on campus greater than a 50% effort. And that will apply. So I'm not quite sure how much, what time, how much effort is being done for the current job. Now, if you've got 50% effort, then yes, you could keep it for sure.
I would say that specifically related to this question, it's challenging. And so I would say follow up with Gabriella Fan about this specific question. I believe that because funds paid through employment is very different than funds that go to students to pay for tuition and fees and whatnot. So for this particular question, I would recommend that you reach out to Gabriella Fan for further clarification.
Thank you. And I didn't, I think it's theoretically possible, but whether it's advisable might be a different answer.
Yeah.
I will put Gabriella's email in the chat now.
If there are, I mean, we're going through the chat, but if there are questions that folks would like to come off of mute to ask, that would be lovely. I'm a little lost on the chat.
I think I've caught all of them thus far.
Oh, fantastic.
Um, I do believe, I hope we answered the question about the fact that we encourage people who are interdisciplinary, and I mean, transportation urban planning seems like very, very applicable to the ways that we would be looking at and training and problems. And know that the dissertation committee can be composed of members. In fact, you are required to find members outside of the department, and we would highly encourage outside of the school as well for folks who would, that makes sense.
Mhm.
Um, I think so far.
Oh, Karen, do you have a question?
Yes, I have a question about the program. In terms of like the community like center research, is that like very focused on the participatory research and community engagement involvement?
Very much so. Yeah, you
Okay.
will find that many faculty, if not the majority of our faculty in our department, have elements of community engagement and are quite the practitioner of CBPR or community-based participatory research, participatory action research, methodologies. Yes, absolutely.
Okay. Okay, yeah, because I come from the community workers, like health workers
Yeah.
environment. So I was looking for a program that it was like an extension of
Yeah.
that.
Oh, absolutely. Yeah, I myself do a lot of work around developing the public health workforce by utilizing and strengthening community health workers as well. And so there's a lot of faculty that have those similar interests.
Thank
Yeah,
you.
of course.
I did miss a few questions, so I hope I'm capturing them early on. And if you'd like to unmute yourself and ask a follow-up question, you're absolutely invited to do so.
I see a hand up from a Faf.
Yes, sir. Uh, can I ask?
Please.
Hello?
Yes.
Yeah, sorry. Actually, I think my connection was disconnected, so I couldn't hear if you answered my question. With respect, I have done master in public health, but there was like a track you have to choose a subspecialty. So I chose health economics. But now, whenever I apply to PhD, so there are different schools that they have like Department of Business and Economics. You can go to health economics. Although my major is public health, so I'm confused that whether your university deals with like the same, or I can apply in public health, or I have to go to business and account or business and economics for health economics PhD. Although I have interest in different all the, but just because my subspecialty is health economics.
Yeah. I can take a stab because I did actually answer your question in the chat as well. So I think that your background in public health and interest in health economics makes you potentially a good fit for our program. We want to be, we encourage people who have potentially, policy interests and research. And in fact, our department chair is an expert in healthcare, health insurance and healthcare policies, not just solely economics, but that's certainly a component of it. However, I would encourage you to look at the faculty and ensure, you should do your own due diligence about whether you believe that we have enough of the breadth and depth of the expertise that you're looking for in order to pursue your PhD.
So for that, I do need to contact potential supervisors, because like I have to mention the name at some stages, or in my essays, I have to mention someone who has the interest, and later on, if they are not specifically from health economics. So do I need to contact with potential supervisors for this? It,
You don't have to. You are
mm-hmm.
welcome. And you
Okay.
do not have to have a faculty member say yes prior to applying. So you are, but as Dr. Tanjasiri recommended, look into our faculty and assess whether or not our faculty will actually give you what you need to succeed in your career as you've envisioned it. So you may find that there are other programs that you may be more interested in because of the faculty and the course offerings that only you know based on your conceptualization of your career path. So, but you're welcome to apply and you're welcome to reach out to faculty. And yes, and some people do research or research faculty and then not have a conversation with them, but can still have a very clear idea as to how those faculty might be supportive of their research interests in their essays. So none of these communication milestones are required. You don't have to reach out to faculty. You don't have to have a meeting. They don't have to say yes to you prior to applying. You can look into their work, and then you can also talk about how those faculty interests and that faculty research would support your work and your essays without having an initial conversation either. All of the
Thank
above.
you so much. Thank you so much, ma'am. Thank you so much, sir. It was such a nice session. Thank you so much.
Very good. If I can make just a suggestion, this is not a requirement, but as we've said, we do encourage you to contact faculty because, of course, part of the whole process of applying is ensuring it's a good fit for you. So take a look at the list of faculty expertise, find any faculty who you think that you are particularly in alignment with or you'd like to learn from, etc. And then reach out. In the reaching out, I would actually encourage you to share your interests with us. Why are you reaching out to a particular faculty member? What makes them stand out as a potential, in your development and your areas of interest? It's difficult to respond to general inquiries. For example, a request to take a look at your CV and give feedback on if it's a good fit. Partly because many of you you've done different things, and it's hard to suss out from a CV whether there's a fit. And also partly because you might have done something, but your interest could be in a different area or not completely clear. And I think the last thing, at least I personally want to do, is steer you in a way to do a PhD on a research area that doesn't reflect what you're interested in. So I think, like the previous student was talking about, what is your interest and why would you be seeking out a particular faculty member for some feedback? Those are always much more helpful for us than a kind of general inquiries about, are you a fit for our program? Because we're not oftentimes entirely sure how to evaluate those.
Yeah, I would like to just emphasize that this is as much a decision on your part than it is on the selection committees, and also when you reach out to potential faculty, please reach out and put forward information that explains and contextualizes why this person fits your work and your interests. Again, very general requests are not always the most successful. There's also another question by William. Thank you for this question. How does this program differ from the PhD in public health at UCI? The main differentiation is our focus on structural determinants and interventions and community engagement. However, for how our PhD programs are growing, a main differentiation between the PhD program and public health is faculty. So if you are thinking about how your interests align with potential faculty members, if you are applying to the PhD in Health, Society, and Behavior, your interests ought to align with and be in conversation with faculty in that program. If you are deciding to apply for the PhD program in public health with concentrations in global health, disease prevention, and biobehavioral mechanisms in health. If you're applying to that program, you would want to think about your interests in relationship to the faculty in the Department of PhDP, Population Health and Disease Prevention. So there's a bit of a differentiation between the faculty that are supporting both of those PhD programs moving forward. So that's an easy way of differentiating between programs.
Great. These are fantastic questions. Thank you so much, everyone, for your engagement. I think we are caught up. No, there's a new question. Oh, can we apply to both programs? Absolutely, you can.
Actually, I don't think so, Dr. Tanjasiri. You
No?
may have to confirm that. I believe that graduate division you can only apply to one graduate division program.
Email
So
me then. The reason why, and this is something that will just happen behind the scenes, is we know that this is, since we're launching this new PhD program, we're going to be in constant communication with the current PhD program, because it could be that you think you're applying to one, but you really meant the other. And so we know that it's not as crystal clear as we would like it to be. But thank you for pointing out that perhaps physically you can only apply.
So, and Dr. Tanasiri, and related to that, if we have applicants in our pool that are strong applicants that might be a better fit for the other PhD program, we will make that recommendation we'll make that recommendation to the selection committee of that particular program, just an FYI.
There is another question, and let me see if I follow it. So the question is the structure of the program, if the structure includes a core element, right, first 1 or 2 years, followed by the project on the research topic. So is that how we're structured, number one? And then two, what is the methodological training? And the examples are quantitative, qualitative, mixed methods, and applied health research. So yes, the structure of the program, one might think a typical 4 years or 5 years would be that the first 2 years you'd be enmeshed in coursework, in getting your core coursework done and your major electives. You can take coursework throughout your entire time. You do not need to just limit it to the first two, but certainly by the second year, or maybe the early in the third year, you would be thinking about advancing to candidacy, which means that you are developing a proposal, probably more in your third year, and then presenting it to your committee for approval before then, and advancing to candidacy before embarking on your independent research. So yes, but again, it really depends on what you're trying to do and where the courses are, and of course, when they're offered, right? What is the methodological training? It will be definitely quantitative. We have some and trying to grow our qualitative. And I don't know that we have a true mixed methods course yet, but we're trying to go in that direction, and very much application. So we are strongly, or I should say, we're very interested in students who are pursuing interventions. Now, a certain interventions may not be doable, right, within your time period here with us, but you are moving in that direction. So applied health research would be absolutely a plus.
And I dropped a link in the chat that covers our preparatory module, which students usually complete within the first 2 years, as well as the methods module. So you'll see options there for advanced statistics and advanced modeling, but also some more area-specific approaches like social network analysis and/or geographic information systems. So you'll see that there on that link, and then students complete courses within our particular concentration module in health, society, and behavior.
And for those of you who are following the chat, you can see that someone shared the link to the landing page for our PhD program, and then there's a drop-down menu to link to the faculty, all the faculty in their areas of expertise. Okay, we've got a few more minutes if anyone has any further questions. And I put my email in the chat. If you don't have that, I'll put it in again in case you think of a question later on and would like some clarification. There's another question. For students with a master's, what makes them able to complete the program within 4 years rather than 5?
Yeah, we actually at the very beginning of if for students that have a master's in public health from a CEF accredited institution, we are able to satisfy similar equivalent course requirements that you may have taken in your master's program for our and satisfy requirements that we have in our program. So that is in a case-by-case basis. It is a product of students ask for certain courses to be waived. We ask students to produce a rationale and also the syllabi for those courses. We sit with both of those. We sit with the syllabi of courses that you've taken with the syllabi that we are teaching, and then we assess those two courses around their equivalency, and then are able to either waive a course or recommend that you take that course here at UCI. So there is a process there to reduce the number of courses that you're required courses that you're taking.
Great, and I just confirm that. Okay, looks like that answered the question. Wonderful. Okay. I guess we'll turn to the room then. If anyone has questions and they'd like to raise their hand, we encourage you to do so. Otherwise, just one more review of all the questions. I think we have answered them all, and to the best of our ability.
I guess I will also maybe offer to everyone that I'm somewhat of a new faculty member at UCI. I came from UCSF prior, and I wanted to share that as the co-director of the program. I really do feel that the community that faculty are actively building among each other and with our students and trainees and the community organizations that we partner with, and across the school, I feel like we are really inspired and motivated to create a community of scholarship where we know that we all may have varied interests and varied methods in terms of getting from point A to health justice and eliminating health disparities and healthcare for all, et cetera, et cetera. I feel like we are creating a space where we can all intermingle and also consider methods outside of our own methodological toolboxes to achieve that. As the quote goes, a rising tide lifts all boats. I think that we are creating a culture and a community to really see that the many communities that we work with in the various disease areas that we work with all benefit from equity work and higher structural intervention work.
Thank you. I do realize that I missed a few questions in the Q&A, so I've been trying to take care of them. There is one, I think it's from the same individual that asking about international scholarships and a master's degree, especially the health economics. I think we addressed that one. There is a similar one around the IELTS is 7, but unfortunately one category is 6. So are there any rules for minimum scores in one category? Do you know, Dr. Arayasirikul? I don't know. I think that the University is only given as a total score. It's
That's
not a
right.
component score. Okay, good. And then there's one last thing. Could you let us know selection criteria, competition criteria? Okay. We can take a stab at that. So we wanted to demystify this for you. Part of the reason why we're doing this information session is because we want to encourage you to, in your application materials, make the best, the strongest case for the fit with our program. Honestly, I believe probably all of you could do fine in our PhD program, but really we are designed to, of course, hopefully be of greatest opportunity for those of you who are ready to undertake this kind of a doctoral program in the future. So I will say that the review criteria are really on the fit of your interests, the fit with the program as stated in our program materials, and of course, our ability to be able to match you with more and more advisors who have the area of expertise that would be the most in line with and beneficial to you. So I'm sure you can all articulate fascinating research questions. In fact, I love those kinds of conversations. And while we may want to be able to serve you, we know we don't have the faculty, for example, and the expertise to be able to fully maximize the things that you can accomplish with this. So please take a critical eye, look at a critical eye at what we do have, and then in your application materials and your letters of recommendation, et cetera, to the degree that they can, talk about why this program, what are your research interests, and who might you want to study with. That will be the basis for, our applications, once obviously we find that you meet the minimum requirements, which I assume all of you do. Anything else that you'd like to add? Dr. Arayasirikul?
I would add, I guess, the emphasis around structure and multi-level social structure. And I feel like that is, if you are interested in uh, decreasing LDL cholesterol, that is really important. That may, and all of your methods to do so or interests lie around, maybe direct patient care. That may not be a well fit, a strong fit for the kinds of thinking and upstream factors that we are looking for. So I think that definitely think about your interests with a critical lens.
Okay, and with that, we had one other question about whether we'll be holding interviews. We'll be holding virtual interviews. Please see the slide on the time frame. We anticipate that'll be sometime in early January.
Yep.
With that, we want to say thank you again for your interest in our program. Please know that this will be posted so that you can refer back to this recording if you missed anything. And we've already shared with you our email addresses if you want to follow up with us for a specific question. Okay.
Thank you so much.
Thank you, everyone. Have a great evening.
Bye, y'all.